And what is your approach to positioning immunotherapy in triple negative breast cancer, and how do you frame patient selection in practice?
So, Keynote 522 has been a study that revolutionized the way that we treat stage 2 and stage 3 triple negative breast cancer. Um, Routinely, the um, mainstay for these patients was neoadjuvant chemotherapy, and then Keynote 522 layered in pembrolizumab on top of that immunotherapy agent. So I'm oftentimes looking at immunotherapy plus chemotherapy in the neoadjuvant setting in my patients that have more than 2 centimeters of triple negative breast cancer or have evidence of lymph node involvement. There are ongoing studies to determine, can we leverage that pembrolizumab and be able to give less chemotherapy and still have non-inferior outcomes. And so this is exciting times, including a clinical trial that we have going on at the University of Kansas Cancer Center, looking at certain characteristics and seeing if we can find a way to deliver less chemotherapy and have similar outcomes.
Interesting. And for patients with metastatic disease, how do you balance disease control, toxicity, and quality of life when planning long term treatment strategies?
Yeah. Stage 4 metastatic breast cancer in 2026 is unfortunately an incurable disease. That being said, it can become a chronic disease, and of critical importance is balancing potential toxicities with extending patients' lives. These are very difficult conversations to have at time because it requires being honest with the patients and telling them, I will remind them that I have lots of treatment options and continue with clinical trials and with new advancements to have more tools in my toolbox to help combat this disease. However, I want to make sure that as I extend their life, that the quality of life that they have is meaningful, because patients will often talk to me when it's not that, and then we have to reevaluate. So it's about having open lines of communication, asking patients for their opinions, and also making sure that their quality of life is what they want it to be, because if it's not, then having the ability to adjust that, lower doses, consider switching treatments, taking treatment breaks, are all things that I've used because it's quality of life is incredibly important.
And especially with younger patients, how are you approaching conversations about prognosis and reoccurrence risk in a way that's both honest and supportive?
Yeah. Um, it is of utmost importance to be honest with your patients. That's every time. Patients don't want information withheld from them. They don't want this to be sugar coated. They would rather prefer to leverage, because this is for many of them the first time they're going through this. They're looking for information. They're looking for guidance, because it's a scary time when your body is, going through this cancer phase, this cancer diagnosis. So just sitting down, saying, this is what I have, this is the best evidence, these are the numbers that I deal with, and this is what I think makes the most sense for your treatment. Making sure that all their questions are addressed to the best of your abilities, and making sure that they feel comfortable with asking these information to make the best decisions for them.
And like you mentioned earlier, there's a lot of news that comes out about breast cancer all the time. And especially when you have younger patients or more savvy patients that are looking for information. So I'm wondering, when there are several clinically reasonable options, what communication strategies are you using to help you align the treatment plan with a patient's preferences and their life circumstances?
So, um, I'm very privileged that the vast majority of my practice is breast cancer. And so I enjoy being able to sit down with a patient, if I'm seeing them for a second opinion or for a first opinion, and telling them that 95% of what I do is breast cancer. It's important to give them the information that is known in current literature, and also sometimes we have two reasonable treatments that are not directly compared head to head. You talk about the risks and benefits of both. Also, especially with new diagnoses or when changes of treatment need to be made, being evaluated at centers that have access to clinical trials is vitally important too, because not only are we looking for new drugs or new combination of drugs, we're also we have a lot more de-escalation studies. Do we need to do all these things? And so these are things that happen at the onset or when we need to make treatments and not halfway through. So making sure you're feeling confident with the treatment plan before moving forward is important.